it turns that part off. So yes, it does literally make you more stupid. And for everyday smokers, it can decrease your IQ 10 points. So if you didn't have much to start out with, that is the difference between normal intelligence and having an intellectual disability.
It's Doctora Victoria and George.
Cannabis, also known as marijuana, weed, skunk, hash, herb, and many more, is an intriguing topic. It is the third most commonly used psychoactive substance worldwide after alcohol and tobacco.
Dang, Doc. That's what we're talking about today? We're gonna get groovy. What makes cannabis so psychoactive?
Well, the psychoactive properties of cannabis are primarily due to a cannabinoid called delta-9 tetrahydrocannabinol, or THC. It's the compound responsible for the euphoric high feeling, as well as the sedative and analgesic effects.
Dang, that's quite highly interesting topic. I've heard that the illegal status of cannabis varies across countries. What's the situation in the United States?
You're right. The legal status of cannabis varies internationally and across the U.S. Some places have legalized it for both medical and recreational purposes, while others have more restrictive laws.
Interesting. I've also read that the potency of cannabis has increased worldwide. What impact does that have?
Well, the increase in cannabis potency may contribute to higher rates of cannabis-related adverse effects. As cannabis becomes more potent, users may experience stronger effects and, in some cases, more significant negative consequences.
And how common is cannabis use globally?
Well, in 2019, approximately 4% of the global population between the ages of 15 and 64 years, around 200.4 million people, use cannabis. It's most prevalent in North America, Australia, and New Zealand.
That's a high number of users. How about the United States?
Well, in the U.S., a large survey estimated that around 46% of the population aged 12 and older had used cannabis in their lifetime, and 12% used it within the past month.
Are there specific age groups or genders more likely to use cannabis?
Well, young adults between 18 and 25 years old tend to have the highest prevalence of cannabis use, with males having slightly higher use rates than females. Additionally, college graduates and those not in the labor force are less likely to use cannabis.
Is cannabis use more common among certain demographic groups?
Well, yes, cannabis use is present in all socio-demographic groups, but some groups show higher prevalence rates. For example, pregnant women are less likely to use cannabis, and those living in rural areas are also less likely to use it. And it's important to not smoke marijuana during pregnancy. First off, it can get you a longer stay in the hospital because it shows up in drug tests. And depending on the hospital, they're going to keep you longer because a drug-using mom has a baby at higher risk of a low birth rate, neonatal death, and being on the autism spectrum.
What about the risk of developing cannabis use disorder?
So frequent and long-term cannabis use are primary risk factors for developing cannabis use disorder. Genetic factors and certain psychosocial elements such as mood disorders and substance use can also play a role.
I never knew there were so many factors involved. This information eye-opening.
Well, nice, George. I understand that cannabis has gained popularity, especially for medical and recreational use. However, it's essential to be aware of its adverse effects as well. For instance, cannabis use disorder may lead to comorbid psychiatric and substance use disorders, contributing to morbidity. But when we look at the bigger picture, cannabis use disorder only constitutes a small percentage of the global burden of disease compared to other substance use disorders.
I see. So it's not as significant as some other substances use disorders in terms of overall health burden.
Well, that's correct. According to the Global Burden of Disease Project, cannabis use disorder was associated with only 6.4% of disability-adjusted life years attributed to substance use disorders in the United States and Canada.
No way. Now, it can't kill you, can it? Does cannabis increase the risk of all mortality?
Well, the evidence on all-cause mortality is insufficient to draw a conclusive link. However, a longitudinal study of individuals born in Sweden between 1955 and 1960 found that cannabis use disorder had a higher mortality rate than the general population.
Dang, that's concerning. Do we know the primary causes of death associated with cannabis use?
Well, the most common causes of death linked to cannabis use are accidents, primarily motor vehicle accidents, suicide, and medical conditions like cardiovascular and pulmonary diseases. It's worth noting that other psychoactive substances, especially alcohol, are frequently involved in these cases.
Whew. Okay, so it's not just cannabis use alone that leads to these outcomes for the most part. What about medical and systematic effects? Are there any effects on the lungs?
Well, yes, there is evidence suggesting that smoking marijuana can contribute to respiratory symptoms and possibly a respiratory disease. Studies indicate that smoking marijuana is associated with cough, sputum production, wheezing, and shortness of breath. Additionally, cannabis inhalation can acutely exacerbate asthma, although the association between chronic cannabis use and asthma remains unclear.
Oh no, Doc. That's concerning. For people with respiratory issues, are there any links between cannabis use and cancer?
There is molecular, cellular, and histopathological evidence suggesting that cannabis smoking may cause cancer. However, epidemiological studies do not consistently show a clear association. For example, some studies found no significant association between cannabis smoking and lung cancer, while others found a link with specific types of lung cancer. Further research is needed to fully understand this relationship.
What about the impact on the cardiovascular system? Is cannabis use linked to heart-related issues?
Yes, cannabis smoking has a possible association with conditions like myocardial infarction, that's a heart attack, stroke, and arrhythmias, wrong rhythms in the heart. Studies have found significant associations between frequent cannabis use and the risk of lifetime myocardial infarction or coronary artery disease. Additionally, acute cardiovascular effects like tachycardia, vasodilation, blood vessels getting big, and increased myocardial oxygen demand have been observed after smoking cannabis.
It sounds like there are various health implications associated with cannabis use. Are there any specific syndromes related to cannabis?
Yeah, one notable syndrome is cannabinoid hyperemesis syndrome, which involves severe nausea, vomiting, and abdominal pain that is relieved by exposure to hot water, like a shower or bath. This condition is usually seen in daily cannabis users for at least 1 year.
Okay, I get it, Doc. It's the devil's letters. Now, what about sexual function, reproduction system, and neonatal outcomes?
Several studies suggest that cannabis use does not impair sexual function in healthy individuals or delay time in pregnancy in couples trying to conceive. However, cannabis use is associated with reduced spermatogenesis, that's the making of sperm, and impaired sperm function in some studies. Additionally, cannabinoids have been detected in breast milk of lactating women who use cannabis, raising concerns about potential effects on infants.
Oh no, not George Jr. That's good to know though. What about cognitive effects and neuroimaging changes?
Cannabis use acutely impairs cognitive functioning, like attention, memory, and learning. There's also evidence of long-term cognitive impairment, especially with heavy and prolonged use. Neuroimaging studies show associations between cannabis use and reduced brain volume in certain regions. This is particularly at the frontal cortex. That's the front part of your brain that plays an important role in forming memories and higher level thought processes. It turns that part off. So yes, it does literally make you more stupid. And for everyday smokers, it can decrease your IQ 10 points. So if you didn't have much to start out with, that is the difference between normal intelligence and having an intellectual disability.
Dang, that's quite a range of effects. I regret all my Cheech and Chong days.
Oh, George.
I never realized cannabis had such an effect and impact on health. Are there any other systematic effects?
You know it, George. Yes, cannabis use is not associated with acute hepatotoxicity, that's problems with the liver, or worsening progression of hepatic fibrosis in patients with chronic viral hepatitis C. Sometimes these things can all be happening at once. It's also not associated with nephrotoxicity, that's problems in the kidneys in healthy individuals. Although it may accelerate the decline in kidney function among men with hypertensive kidney disease. And hypertensive just means a high blood pressure.
I'm learning a lot today. Somehow the topic always comes up when I'm in the sauna at the gym.
Well, gotta love the sauna, George. It sounds like you've been having some very interesting discussions lately. Are you interested in learning more about smoking or maybe alcohol? Check out these videos next, and thanks for joining us today, our healthcare team. We hope that you'll join us next time. Bye-bye.
Bye-bye.